Good afternoon, guys. I have discussion A for y'all. Let me get set up for the show and I'll be right with you, please. Okay, give me a minute, please. Okay, here we go. Mental health symptoms such as agitation, depression, apathy, and sleep disturbances are common in Alzheimer's disease and may appear before memory decline. A study from Boston University found that the biological pathology of AD may directly contribute to these emotional and behavioral symptoms. Researchers analyzed data from the National Alzheimer's Coordinating Center, or CSF, biomarkers, cognitive testing, and caregiver ratings of patients' mental health. The study emphasizes that early detection and management of these mental health symptoms could be crucial for improving quality of life for both patients and families. This research supports growing recognition that Alzheimer's is more than just a memory disorder. It's also deeply tied to emotional well-being. Would you like to explore how this might influence early intervention strategies or patient care models? Managing mental health in Alzheimer's patients requires compassionate, multifaceted approach and addresses both emotional and neurological needs. Here are some of the most effective strategies supported by current research and clinical practice. Early identification and monitoring. Recognize symptoms like apathy, aggression, or irritation, um, agitation, and depression or sleep disturbances early, as they may precede memory decline. Use caregiver input and tools like the uh, neuropsychiatric inventory, or NPI, to track behavioral changes over time. 2. Non-pharmacological interventions. Routine and structure. Establishing predictable daily routines can reduce anxiety and confusion. Music and art therapy. These can tap into preserved emotional memory and improve mood. Resilience, reminiscent therapy. Discussing past experiences can foster connection and reduce agitation. Physical activity. Gentle exercises like walking or Tai Chi can improve sleep and reduce depression. 3. Environmental modifications. Reduce noise and clutter to minimize overstimulation. Use calming lighting and familiar objects to create a sense of safety and orientation. Caregivers communication techniques. Use simple, reassuring language and maintain eye contact. Validate emotions rather than correcting memory errors. This builds trust and reduces distress. Pharmacological support when necessary. Antidepressants or antipsychotics may be used cautiously for severe symptoms, but non-drug approaches are preferred. First line due to side effects. Support for caregivers. Educate caregivers on behavioral strategies and stress management. Encourage participation in support groups to reduce burnout and improve patient outcomes. Would you like to explore how these strategies could be tailored to specific stages of Alzheimer's or integrated into care plans? Tailoring mental health strategies to the stages of Alzheimer's is essential for preserving dignity, reducing distress, and enhancing quality of life. Here's how these approaches can evolve across the disease trajectory. Okay, guys, I'm going to break these down for you now. So here, we'll go right now. Early stage, mild cognitive impairment to early Alzheimer's. Focus, empowerment, routine, and emotional support. Strategies, encourage independence with memory aids, calendars, pill organizers. Reduce cognitive stimulation, puzzles, current events, discussions. Address emerging depression or anxiety with talk therapy or mindfulness. begin advanced care planning while the person can still participate. Mid-stage, moderate Alzheimer's, focus, structure, safety, and emotional connection. Strategies: use simplified communication and visual cues to reduce frustration. Implement personalized activities like music therapy or reminiscent sessions to reduce agitation. Manage behavior symptoms, wandering, aggression, with environmental adjustments and caregiving training. Monitor sleep and appetite closely. Disturbances often emerge here. Late stage, severe Alzheimer's, focus, comfort, dignity, and sensory engagement. Strategies: use sensory therapies, gentle touch, aroma therapy, soothing music to reduce distress. Provide full assistance with daily care while preserving dignity. Address pain, discomfort, and emotional needs through palliative approaches. Support caregivers with respite care and grief counseling, guys. Because people start grieving before their loved one dies, because they watch them go, they watch the disease take them over slowly. Okay, so thought I'd give everybody that one for an FYI. Each stage calls for a shift in mindset from promoting autonomy to ensuring comfort. Would you like help designing a stage specific care plan or exploring how these strategies intersect with caregiver well-being? Absolutely. Here's a stage by stage breakdown of meaningful activities tailored to the evolving needs of someone with Alzheimer's. Okay. Early stage, mild cognitive impairment. Okay. Early Alzheimer's. Goal: promote independence, cognitive stimulation, and emotional well-being. Cognitive games: crosswords, puzzles, Sudoku, or memory card games. Creative expression: painting, journaling, or digital photography. Social engagement: book clubs, memory cafes, or volunteering. Physical activity: walking groups, Tai Chi, or light gardening. Technology use: video calls with family, dementia-friendly apps. Middle stage, moderate Alzheimer's. Goal: reducing frustration, maintaining routines, and fostering emotional connections. Reminiscent activities: looking through photo albums or creating a memory box. Music therapy, singing familiar songs or playing simple instruments. Household tasks, folding laundry, setting table, or washing or watering plants. Sensory stimulation, sorting objects by color or texture, using tactical fabrics, simplifying games, large puzzle pieces, matching games or picture bingo. Late stage severe Alzheimer's. Goal, providing comfort, sensory engagement, and preserve dignity. Soothing touch, hand massages with scented lotion or brushing hair. Aromatherapy, diffusing calming scents like lavender or citrus. Visual stimulation, watching birds, colorful sensory books, or slow moving videos. Music and rhythm, gentle swaying to familiar tunes or soft background music. One-on-one time, holding hands, reading aloud, or simply sitting together in nature. Each activity can be adapted based on the person's preferences and energy levels. Would you like help designing a weekly activity plan or exploring how caregivers can use these moments to strengthen connections and reduce burnout? Great question. The most effective activities for each stage of Alzheimer's are those that align with the person's cognitive and emotional abilities at that point in the disease. Here's a breakdown based on the latest evidence and best practices. Early stage mild cognitive impairment to early Alzheimer's. Goal, stimulate cognition, preserve independence, and support emotional well-being. Cognitive games, Sudoku, word scrambles, or digital brain training apps. Creative outlets, painting, journaling, or photography. Social engagement, memory cafes, book clubs, or volunteering. Physical activity, walking, tai chi, or water aerobics. Technology use, video calls, online classes, or music playlists. These activities can help maintain a sense of dignity and purpose while slowing cognitive decline. Middle stage, moderate Alzheimer's. Goal: reducing agitation, maintaining routines, and foster emotional connection. Reminiscent therapy, photo albums, memory boxes, or storytelling. Music therapy, singing familiar songs or playing simple instruments. Tactile tasks, folding laundry, sorting objects, or gardening. Simplified games, picture bingo, large piece puzzles, or matching games. Sensory stimulation, textured fabrics, aromatherapy, or nature walks. These activities support emotional regulation and reduce behavioral symptoms like wandering or aggression. Late stage severe Alzheimer's. Goal: provide comfort, sensory engagement, and preserve dignity. Smooth touch, hand massage or brushing hair or holding hands. Aromatherapy, familiar scents like lavender or citrus. Visual and auditory stimulation, watching birds, listening to calming music, or viewing slow moving videos. Familiar objects, stuffed animals, soft blankets, or sensory quilts. One-on-one time, reading aloud, gentle conversation, or sitting together in silence. These activities are most effective when they're simple, repetitive, and emotionally grounding. Would you, uh, if you'd like, I can help design a weekly activity plan that evolves with each stage, with the stages, or explore how caregivers can use these moments to strengthen connection and reduce burnout. Adapting activities for individuals' preferences in Alzheimer's care is all about honoring the person's identity, history, and current abilities. Here's how you can personalize activities meaningfully across all stages. Start with their life story, hobbies, and passions. That they love gardening, music, or fixing things. Recreate simplified versions of these experiences. Career background. A retired teacher might enjoy reading aloud or organizing books. A former chef might enjoy stirring ingredients or sharing recipes. Cultural and spiritual values include music, holidays, or rituals that reflect their heritage or beliefs. 2. Match activities to current abilities. Cognitive level. Choose tasks that are rather neither too easy nor too frustrating for example. If puzzles are too complex, hold on. Try matching game with large images. Physical capacity. Adapt for mobility, seated exercises. Lightweight tools or hand over hand guidance can help. Sensory preferences. Some people respond better to touch, i.e., textured fabrics, other sound things, familiar songs. 3. Offer choices and observe responses. Present 2 or 3 options and watch for signs of interest or withdrawal. If they seem engaged, try a different time of day or a quieter environment. 4. Embrace flexibility. Be ready to pivot what works. One day may not work. The next one day may not work. The next. Let go of outcomes. If they enjoy watching rather than participating, that's still meaningful engagement. 5. Involve them in the process. Ask for their input when possible. Would you like to listen to music? Would you like to listen to music or go for a walk? Even nonverbal cues like a smile or relaxed posture can guide your choices. If you'd like, I can help build a personalized activity toolkit based on a specific person's background or preferences. Would that be helpful? Okay, guys, so that is A for this afternoon. I'll be back on with B shortly. Let me get it together and I'll be back on with you. Give me a few minutes, please. For now, Gator Wellness, take care, folks.